Hello, everyone, and welcome to ARM Studios. My name is Rita Johnson-Greene, and I'm the Chief Operating Officer at the Alliance for Regenerative Medicine. And I have the pleasure of interviewing Allan Reine, the CEO of Prime Medicine. Thank you so much for being here with me today, Allan.
Thank you for having me here.
No, absolutely. So let's jump right in with the technology. Prime has built a very distinctive platform for prime editing. And so can you tell our audience what is prime editing and what makes it so distinct? And maybe talk a little bit about the platform itself as well as the pipeline that makes prime editing so unique.
Yeah, so I like to say, prime editing really is the most versatile way to edit the genome, and it's also the safest way to edit the genome. So you have to sort of think about the evolution of gene editing and how we got to kind of where we are today. And it really started with the, Nobel-winning technology of CRISPR, right? Which for the first time, with very high efficiency, you could actually locate a very specific place within your genome that you want to edit, and it does a very good job of making what's called a double-stranded break, and really good and effective at essentially turning genes off or knocking things out that can affect gene expression. But it is somewhat limited in what it can do. It's very effective in what it can do, but it's limited. And then along came another technology out of our scientific co-founder, David Liu's lab, which was called base editing. And with that, for the first time, you could actually go in and using an additional enzyme into the mix. They do a couple of things. One, they're using sort of a modified CRISPR enzyme, so it's making a single-stranded break. So what does that mean? It means it's a lot gentler on your DNA. It's a lot gentler on the cells. And as a result, you don't get sort of the off-target type of things that you would get with typical CRISPR-based editing. But using this sort of additional enzyme, they can now modify your base pair. So they can change one base pair into another. And that's really incredible technology, but they're also limited in which they can only change one base pair to another base pair in sort of 4 of those instances. And with prime editing, it was out of David Liu's lab again, we're gonna add a different enzyme to the mix, which can convert RNA into DNA. And we can transcribe that directly into your genome. So the first time ever, we can really take a string of base pairs, a string of your genetic code, and dictate exactly what you want that correction to be. So it's incredibly powerful, a really powerful technology. As you said, we spent the last 5 or 6 years really developing this, and we've taken it to a place today where we're really focused on a few key programs.
Fantastic and very exciting things going on at Prime. You talked a bit about the diverse pipeline that you have, as well as the versatility of the Prime approach. Just leading into investors, we know that Prime had a very significant raise this year. And my question for you is, what do you think specifically resonated with investors about the Prime approach?
Yeah, so I became CEO, I think it was May 19th, and we did an equity raise in early August. And I think I probably met with over 60 investors over that period of time, and some more than once. So the total number of investor meetings was pretty significant. It's I think investors, and I have the luxury of being an investor for 15 years prior to myself going into the operational side. So that experience kind of helps me really understand what investors want to hear. And it's not just what they want to hear, but it's actually what are you doing, right? Mm-hmm. And so as an investor, you really want to understand, if I'm going to give this company capital, is that capital going to be spent in the right way, right? Do I trust the management team of this company to be good stewards of my capital? And so I think what was important for me, and when I was speaking to investors, was being really clear about what I call capital allocation strategy is. What that means is, what are we going to spend our money on, right? Be very clear, be very transparent with these are the programs we're going to invest in. These are the timelines to getting to inflection points from those programs. And them getting comfortable with why we're making those investments, right? So it's also walking the investor through why we're investing in these programs, why this is a good capital allocation strategy, why for them, if we're successful, they're going to earn a lot on this investment. At the end of the day, we're trying to find areas where there's unmet need and really help patients, right? Like that's why these companies exist. But we also have investors that are also looking to get a return on their investment.
Yes.
So you have to live in a world where both things can be true. We can really help patients, but at the same time, we can really ensure that investors are successful as well. And if you do those two things well, you can build a really great company.
Wonderful, wonderful. Well, thank you again. I mean, again, it's exciting times. Just congratulations on all of the success, and I wish you continued success and continued collaborations in order to get prime editing out there.
Thank you.
So thank you.
No, thank you, and hope to be back at this conference in the future. It's been a great
Oh,
experience.
absolutely.
Yeah,
Wonderful.
thanks.